Hello, I'm Kathy Chester, and this is Move It or Lose It, a podcast about all things that move the mind, body, spirit, and soul. Hello, welcome to another edition of Move It or Lose It. Today, I have a guest I'm excited about. I know I say that every week, but this one is one I've been trying to get on. So welcome, Dr. Folake, right? Did I say it right? Taylor.
Folake, yes.
Folake. I'm going to work on this the whole time we do this. It's just a very pretty name and I don't want to mess it up. So Dr. Taylor, you've done a lot of research. You've had a lot. Thank you for very, very proficiently answering the questionnaire. You did a great job. I was like, man, she's good. So lots to talk about, lots that you've been through. So let's start in the beginning on pre-diagnosis of MS.
Okay, well, Kathy, thank you, first of all, for having me on.
Thank you.
Excited, for this talk and all that. So pre-MS, well, basically how I remember it is several decades of just a slow decline.
Okay.
And I think the earliest symptoms I would say were in my wrist, just pain, numbness, shooting pain, swelling in my wrists and all that. And the first time I got that checked out, I was a teenager, and this was in the UK. I was diagnosed with tenosynovitis, which you know what that is. It just means inflammation in the tendons of the wrist.
Right.
But by the time I was in med school in my early 20s, my diagnosis had morphed into carpal tunnel syndrome.
Okay, gotcha.
That's what we thought I had. And I had surgery and all of that, but that's kind of how everything started.
So the surgery on the carpal tunnel, how did that go?
Well, it helped the acute symptoms because at that point I was actually losing function in my left hand. So yeah, it did relieve that acute symptom, but what it did not do was it really didn't change the chronic cause of, the pain and the numbness and, up and down symptoms. And I was never able to learn how to type, so there were things I had to work around, and I couldn't do a lot of repetitive motion, clean house and all of those things. Right. So you kind of just learn to work around it. You don't really see it as a disability, but it is.
Yes. But we don't, and we don't want to call it that, right?
Yes. And then because it happens so slowly, you don't even realize how much it's affecting your life. It's just your normal, and it keeps going on. And basically that culminated in probably a few years before my diagnosis. It had gotten to the point where I definitely had difficulty walking. Now, my whole life, the only issues I always had were physical problems, and I didn't know why. I felt like I had an autoimmune disorder, but we didn't know what it was, and all my rheumatologic screen was always negative.
Interesting.
Because, in the UK, they did do all these tests from the beginning, and nothing ever came back. So I'm like, well, one of those days we'll figure it out and stuff. But so that's kind of where it started.
So did they think that you had rheumatoid not to begin with, but back then before?
They thought maybe, but nothing ever actually checked out to be rheumatoid. But I have a rheumatologist. I saw him for years and years because he was a huge part of the diagnosis and ruling out other things.
Right.
I had to do tests I'd never heard of that he had to send out to all these different labs. I had seen
I have rheumatoid and MS.
Okay,
so I know
and MS, so you know exactly. So you know how that works. I had to
and
see
it's such
ENT.
a funky combination too to have
I can imagine.
Because
you don't know which one's affecting your joint because it can be both.
Like, exactly. So I always feel that in the winter, I feel the rheumatoid gets worse. But so does my MS.
Exactly.
So I'm one of the people that I have worse MS in the winter than the summer. So I really sometimes I'm just like, I don't know if it's the rheumatoid or the MS. So one feels sometimes like it's taking over the other. The other days it feels like one's taking. So it's sometimes hard to tell. But I can relate to that They did actually. That's what they did to me. I was with the rheumatologist for a while first, and then they missed the MS diagnosis. So,
Yeah,
so
because
then
of the
fast.
overlaps and stuff.
Exactly. So this was. So how old were you then? Then you were in college already when they were the carpal tunnel and all that.
Yeah, the carpal tunnel. Yes, I was in college, med school,
Okay.
all of that. Yes, I
Okay.
was.
So now I love this. I was reading your bio. You knew at age 8 that you wanted to be a doctor. So
I
you also said that there
did.
was a conversation you had, I believe, with your uncle
My
that
mom's
you said.
uncle.
Okay.
Yes,
So tell me
yes.
about that.
Well, what it was initially I wanted to be a pilot. That was after I watched Airplane. We had
I
those
was wondering,
VHS
what'd you
tapes.
watch?
Yes, it was Airplane, and we had those VHS tapes, and we watched it
Mhm.
over and over and over. And I was just so enthralled. I wanted to be a pilot.
Like a
Then we
funny
had
pilot or a real?
a real
Okay.
pilot. I just got so interested in it. Then after that, I moved on to wanting to be an architect.
Okay.
And we had a family friend who
Uh,
stayed with us when he was in college, and he would build all these models and stuff. And I loved it because I was good with
sure.
Lego. I would basically do Lego to scale with rooms and all
Yes.
kinds of stuff. But then,
Interesting.
yeah, so then this man came around and he was like, "Folake, you're a smart girl. So what do you want to be when you grow up?" And I was like, I want to be an architect. And this man was what we call in Nigeria a chartered accountant, which is the same as a CPA over
Okay.
here. So he looked at me and he said, "By the time you become an architect, computers will be doing that job. The only thing you'll be able to do is teach. They won't really need you for that anymore." I have
Interesting.
no idea how this man way back in, I don't know, late 70s, early 80s, or
Uh,
whatever, knew this stuff.
interesting.
But he
Wow.
explained it to my 8-year-old brain,
Hmm.
and I
And
understood
you
what
made
he
it
was
made sense to
saying.
you.
And he was like, "Why don't you go be a doctor or a pharmacist or something?" And I thought about it. I'm like, okay, back in the day, hospitals had a particular medication smell, especially the pharmacy part of it. And I did not like
Hmm.
that smell. So I'm like, no,
Right.
pharmacy is out. But I'm like, you know
Right.
what? I like to help people, and my
Hmm.
grades are good. I think I can do this. I'm just going to be a doctor. And I never wavered
I love
once I
that
made that
because so
decision.
many times I think of my kids and they're back and forth with they wanted to do 4,000 things. And
And these
so I
days they
love that.
are, and they want to be a
Yes.
superhero and
Oh
all
yeah,
kinds of
for sure.
stuff.
All things. So I love that you were 8, you knew what you wanted to be and you just went
Yes.
for it. So
Yes.
now we fast forward, you're an MD and you've struggled with some of these symptoms and didn't know anything about MS then, though. Didn't know you had MS
Didn't know I
yet.
had it. Yes.
Okay. So then fast forward, you're an MD. And what was your favorite part in that? What did you love the most as being an MD?
I loved just being able to talk to patients in the room. I decided during residency that I was not going to do hospital medicine because
Okay.
I didn't really want to deal with people who were really sick. I wanted to be able to talk about their family, talk about their
Right.
hair, talk about their
Right.
job, and just hang like you're hanging with
Right.
a girlfriend or something.
Sure.
So the favorite part of my residency was always the Tuesday afternoon, which was the half day that I spent in clinic. So it was a no-brainer. I
Yeah.
initially wanted to be a cardiologist, so that would mean finishing the internal medicine residency and then going on to a cardiology
Right.
fellowship. But once I fell in love with that half-day clinic, I'm like, I'm going to do
Mhm.
primary care. And so that's how I
I love
landed
that.
there. Yeah. So that,
Now,
that
how
was my
long were
best
you
part,
in?
just relating to
Oh,
people.
yeah. And I could see that. I mean, even on social media, you're just very relatable. Every time I get tagged in a post, I look and you've already responded in some very encouraging way. And I
Oh,
love that about you. You're just a very big encourager, which is such a blessing with a disease like this and the other autoimmune diseases that go with it, to have someone as cheerful as you are with a great big smile and just as loving as you can be, it just makes such a big difference in our autoimmune world. And so I
thank
love that you do
you.
that. So how long were you practicing as an MD?
Well, I actually practiced for 15 years
Wow.
as a primary care physician in the Atlanta metro area. Yeah.
Interesting.
Mhm.
So then you practiced there. So tell me then about the time of your diagnosis. What led to you knowing that it was MS?
Yes. So it was weird, and it was basically like going from a really high to a really
Yeah.
low. And what it was it was a month after I turned 40.
Okay.
And we had
Which
gone
is
to do.
later to be diagnosed anyway.
Exactly. It is a little bit later to be
Yeah.
diagnosed. But that's because we had missed it. It had been there.
Right.
But I
Right.
guess, when you're a doctor, it's a little bit of a blessing and a curse, because you have certain things and you just figure out how to work around it.
Right.
And it's not a big deal to you. Because I'd had, neuropathy. By this time, I had neuropathy for a few years.
Okay.
And you really
You
had,
just
like I
kind of
said,
learned to
yeah, it had become
work around
hard
it.
to walk a lot. Like if you went on vacation, I knew I couldn't do a lot
Right.
of walking. Now,
Right.
back home, because we drive everywhere, I never
Uh-huh.
really did as much walking at home, that it was a problem. So it just seemed as if it
Right.
was a vacation problem. I could still get up
Okay.
every day and do my elliptical 6 days a week, which is how
Sure.
I stretched out, the tightness that I
Right.
felt in my low back. So I just had little tricks for getting around this
As we
stuff.
do. Yes.
Yes. But a month after I turned 40, we'd gone to Dubai, about 25 friends and family members from all over the world. It was like one of my top 3 best moments in
Oh,
my
I
life. Like
bet. I bet.
after my wedding and the day that I gave birth to my child, that's like number 3, was the day I turned
Oh,
40. Then comes January of 2014. I'm back in Atlanta. I get to work that morning and I feel a twinge in my low back. And,
okay.
I've had back pain before. I've even,
Mhm.
gone to urgent care once or twice, but
Right.
if it goes away, you don't really get an MRI or
Sure.
get much done. You just, yeah, you pulled something and then you got better. But
Right.
this time, over the next 2 weeks, it did not get better. In fact, the pain moved into my left leg.
Okay.
And yes, it moved into my left leg, and I started to drag that leg. So it wasn't just pain, it was also, just weakness, numbness,
Right.
everything. So at
Right.
that point, I was like, okay, I'm going to need an MRI, probably a disc. So I went to a pain doctor, and
Uh-huh.
he did, do the MRI and confirm that I had a disc herniation. But he
Hmm.
was like, why? I had no
Right.
injury. I was fit. I worked
Right.
out. I didn't do a lot of weights and core and everything,
Uh,
but I did my aerobics, and I was,
right.
I had just turned 40. I'm like, why? And
Right.
his answer was, oh, that's about the age when these things happen. No answer really, but it
Right.
was the answer I got. But my husband and
Right.
I didn't really settle for that, and we weren't comfortable with
Thankfully.
that answer. Exactly. But, he started with the epidurals and everything, didn't even refer me for physical therapy. I requested for a referral to physical therapy. I'm like,
Right.
how do you think the epidural alone is going to fix what I have when I'm
Right.
dragging my foot,
Exactly.
So
And
I
so
asked
no
for the,
answer and no, and this was
exactly.
the neurologist.
No, this was a pain doctor,
Oh,
not
gotcha.
a
Okay.
neurologist, it was a
Okay.
pain doctor.
Okay.
But so that's how that went on. For the next few months, I got a little bit better, then I got worse again. And then
Okay.
that's when I went to see the neurosurgeon, and he was like, yeah, we can do some things here and everything. And I ended up having 2 back surgeries in the same month, because I had a discectomy and laminotomy, but then I had a complication of a CSF leak, and the man did not want to accept that I had that complication, because I think he was at his 5% complication rate and didn't want
Right.
my number to skew everything.
Okay.
So
That is
it
a
was,
very sad thing. And
yeah, it is
most of
very
us
sad.
don't know that. So when
Yes,
we're
most of us don't
going,
know that.
and I, I have I have found this through advocating and through my
Mm,
own MS in the last
mhm.
several years. And when it got worse, I realized that if I didn't if I didn't play ball and do exactly what they said, if I
Mhm.
had an idea in any other way, I would either throw their percentage off,
Mhm.
or they no longer wanted me. It was like
Yes.
I would be a problem.
Yeah.
It was no
You're a
longer
problem child. You're
yes,
disobedient. It was like,
yes.
you got to do what I say, kind of
Exactly.
thing.
You're not allowed to have a brain for yourself. You're not allowed
Exactly.
to think for yourself. And I'm sure, as
Exactly.
you would say, that should be for our newer diagnosed patients, that should be a red flag immediately to
Red
you.
flag. Be your own advocate.
Yes.
Listen to everything. Find things outside of what your doctor is telling you that you
Yes.
can add onto it,
Yes.
holistic modalities and all that. I would
Right.
definitely suggest that. So basically, I had those two surgeries. Then
Right.
within a year or so, I had left hip surgery because I had
Okay.
spasticity so bad in my iliopsoas that the tendon had to be lengthened. So it was just so much going on. Still not a diagnosis yet. So
Crazy.
I know. So finally came together in my head. I'm like, I have MS. It's just the
Right.
rare kind. And
I love
did a
because
lot
you were
of
the one that
reading.
diagnosed yourself.
Yes, nobody would have ever put it together. Didn't even send me to a neurologist or anything. Now, I went to the neurologist for like EMG and those kind of things, but
Right.
for the full evaluation, no.
So
So
what do
when
you
I
think
went
the
to
reason is that they did not,
do
they didn't
that,
look that path?
everything is just disjointed in
Yeah.
medicine,
Yes.
and we are satisfied with not having answers. There's a lot of
Hmm.
answers that we don't have in conventional medicine, and
Right.
unfortunately, rather than people looking for answers, they just believe that's the way it is. There's
Yes.
not enough talking across, functional medicine, and
Right.
thank God we have some integrative doctors,
Right.
but there needs
Right.
to be with chiropractors, with everybody. There just needs to be
Yes.
more collaboration. We need to all be talking so that
Yes.
we're coming up with a plan for the greater good of the patient. So I think that's
Absolutely.
why it was missed.
Yeah. I'm sure there were a lot of reasons why it was missed. And there are things that mask it for sure. I know
Yes,
that a lot of
yes,
times it can be a lengthy
yeah.
diagnosis,
For me,
but
it definitely was, yes. And
yeah.
part of
And
that is because being African American, and
right.
there's still not enough research on the ways in which we present differently. If
Exactly.
everything in the McDonald's criteria is based on the Caucasian population,
Right.
mostly male for that
Absolutely.
matter, or whatever,
Right.
then I didn't quite look like that. I didn't
Right.
fit the McDonald's criteria. I was
Right.
just lucky that after the first neurologist basically shooed me away and said he wasn't going to do any more tests, I went to
Right.
the MS Center of Atlanta and I met this really
Okay.
kind, knowledgeable doctor that believed me. And since he couldn't rule me in, I didn't fit criteria, he ruled out everything else that it could be. And that was
Interesting.
how we came about my diagnosis. And he
Okay.
was like, if you see anybody else and they look at this chart, they're going to say, okay, what kind of voodoo did this man perform? How did he come up with MS? But he said, I'm going to call it anyway. And that was such
Yeah,
a
it really
blessing to me.
was.
Yes.
It really is. And it is sad when we hear so many stories of patients going years and years with no diagnosis or the wrong
Mm-hmm.
diagnosis,
Mm-hmm.
being put on like you surgeries that maybe didn't need to happen,
Mm-hmm.
um, medications, several medications that we don't need. And it gets to be a very frustrating battle that you feel like I need a timeout.
I
I need a
know.
time out of this.
I know.
So you're diagnosed now, you finally get the diagnosis of multiple sclerosis. So then fast forward from there, what did they want to put you on? Did they have
Well,
a,
I was diagnosed in 2016. There was no medication for primary progressive multiple sclerosis as of 2016.
so you were
Ocrevus was still in
diagnosed
trials.
immediately to
Um,
progressive, to primary
yeah.
progressive.
Primary progressive is what you start with. You don't start with anything else. So basically, I really had PPMS probably, for several decades, but a lot of people do have a delayed diagnosis. I know remitting relapsing progresses to secondary progressive, but primary
Mhm.
progressive stays there, never goes away, but it's such a slow decline that you don't
Right,
get the optic neuritis and get blind
right,
in one eye. You don't
right,
wake up and you're paralyzed. So you don't get those big things that take you to the ER
right,
and make a doctor say, we need to get an MRI of your brain. So that is
right,
how it gets missed, because it just presents differently and presents similarly to things like rheumatoid and lupus.
right,
And so
right.
you end up spending a lot of time with a rheumatologist.
Yes, yes, I can agree with that. Yes.
Yes, yes. So it took about 8 months because all this tests they had me do, it took a while too. The lumbar puncture and this and
Right.
that, and yeah, do tests. I go back and see him, more MRIs, blah, blah, blah. So it took a while, but he finally called it and he was like, this medication, it was supposed to come out in December of 2016. So he
Okay.
said, let's just wait and get you on the right medicine. Initially, they try the high dose steroids, give it to me once a month kind of thing. That was awful. I had steroid
Yes, it is.
psychosis from
Yes.
that. I was spending too much money, laughing too loud. It made me crazy. So I
Yes.
stopped taking that. But
As one that was diagnosed in the 90s, that was
yes,
continuous steroids.
mostly exactly
Yes.
because they didn't have enough stuff,
No.
back then. So
No.
anyway, I had already started on my holistic journey even since 2014 when I first got sick, even without the diagnosis, because I knew that if we couldn't find what was going on, then I had to turn to, food and supplements. And so I started with stuff like turmeric, like what's it called, cinnamon, garlic, ginger, things like that. That's where I started. And the funny thing is, the conversation that actually got that started was with my rheumatologist. I was like, if I want to go the holistic route, what can I do? I don't even know how I thought he would have an answer, but he did. He suggested about 4 things. CoQ10 may have been one of them, I'm not sure, but he suggested about 4 things, and that was the basis of me getting into alternative medicine.
That's so interesting that he was the one that had answers
and
for
I'm
you.
forever grateful to him.
Oh,
so there was a reason why I was going to see him. He was a really smart man, and he assured me every single time. He's like, you don't have rheumatoid, you don't have fibromyalgia, because when people can't find answers, they say it's fibromyalgia. He said, no, you don't have fibromyalgia. He was sure of what I didn't have. He just wasn't sure of what I had.
What it was that you had.
Yeah, but he stuck by me until we found it. So
he started you on the holistic journey. So with that, talk to me about, and I'm going to turn this light down a little bit. Talk to me about how that was for you, because you really, and I have my MS shirt. So those of you who don't know, we're in March, we're in our month, we're in our MS awareness month. So it's for us. So you had yours on yesterday. I saw that. So you got this MS diagnosis. You're going on with it, trying to figure out some more stuff. 2016, where were they at then? What were they waiting for medication wise for you?
Ocrevus was supposed to come out December, and it didn't, but it came out in March of 2017. So it took a few months, because they had a long list of people who were waiting to get on Ocrevus, people who were completely disabled and really, really sick and stuff. So it took a few months to actually get to me, but I think I started in August of 2017. And what it was with the diet and all that, I already knew that gluten was not my friend. That stopped gluten.
You said that. Yeah, I love that, because you really went from, you didn't go on bonkers, then go to everything. You really,
it was a slow process. It was a slow process.
You found for you that gluten was, which is interesting, because you'll hear a lot of MS people say gluten is not something that bothers them.
Yeah, and that's the thing. We're not all the same.
No,
a lot
we're
of people who are vegan actually are able to eat gluten,
Yeah.
Because it's really hard to be gluten-free, dairy-free, meat-free, and all of those things. So, and we don't all have the same genetics, even with the same diagnosis. So there is no one size fits all. So when people try to convince me I should do what they're doing, I'm like, you're probably doing what is right for you. But is it possible that I'm also doing what is right for me after, searching and weeding, a lot of things out? So of course gluten had to go, and it's been gone. But dairy, I was on and off for a while. It's also gone now. Sugar, I would go off of it. I would play with it. Now it's gone too. A lot of things are gone to get me to where I am now. But what it was initially, while I was slowly easing into all of that, my symptoms were better, but the course of MS was still getting worse. By, I don't know, probably by the year after I got diagnosed or so, I finally started to show lesions in my MRI and all that. So it was obvious I was progressing, because I barely had anything, and now I had clear lesions and all of that. But once I got on Ocrevus, over the next, it may have been about 2 years or so, it wasn't an immediate thing. As it got in my system more and more, I started to get better. Now, when they started with the 26 weeks, at the end, it would be out of my system and I would crash. And then it would take me months to get better. But once we reduced it to every 24 weeks, then that, that worked out fine to where I wasn't crashing in between, because it would basically be like I lost everything I had gained just because
Right.
of those 2 weeks at the end where the
Yes.
medication was out of my system.
Interesting. Because I just
Yes.
started, I'm on, let's see, my fourth dose
Okay.
now of Ocrevus, and it's not
How's
been
it
my
feeling?
favorite. It's
Oh,
not due, but I was on Tysabri for years and I did really well with Tysabri,
man.
and then was JC positive. And
Mhm.
again, you've got to be careful of
Yes.
we went and researched, and I know you talked about this, about not, finding your own team. And here in Michigan,
Mhm.
it's very similar. Unless you're right by U of M, you don't have a team. You have
Mhm.
to find that on your own. So there
Mhm.
wasn't a team of doctors. My neurologist that I was very close to had passed away already. So
Oh.
there wasn't a team of doctors that could help me through that, especially because
Mhm.
COVID had just happened. So
Mhm.
everybody was just kind of at loose ends. And
Yeah,
I certainly
yeah.
didn't want to,
We were
venture
doing
out.
minimal stuff, like only
Exactly.
necessary stuff. If
Exactly.
you're alive, you're good,
Yes, for sure. It just didn't do
Wow.
anything. And I think, took it
Wow.
much different. We already had
Mhm.
an ability to settle ourselves down, to be able
Mm.
to calm down, because there are times when we have to.
Mhm.
So, but during that time is when, at the very end, we were able to visit the Cleveland Clinic and some other
Mm.
places. And I listened to a doctor that was not the best. I did not do my research enough, and I
Mm.
was nerved up because the JC, numbers were going higher. And I went ahead and switched to Ocrevus, with being told that I could go back on Tysabri, which is not
Mm.
true. Um, so, those things happen. Ocrevus, we'll see. It's been in my system for a while. I don't feel nearly as strong. So this is just something that I'm really working on, to see if I can get the strength back that I had. Cognitively
Mhm.
is where I'm
Mhm.
struggling.
Oh,
So it
wow.
talked about cognitive struggles for you. So when did that
Yes.
start for you?
It started pretty within a few years. I clearly, had cognitive issues really early on, actually. It wasn't just the physical fatigue, it was brain fatigue as well.
Mhm.
And it was memory problems. And
Yes.
there was a point where the memory problems were so bad that I would get lost going places, driving places or whatever. I was at a conference in DC, and it was day 2 of the conference. When I got to to the site, I couldn't find my way to the same hall we had been in the day before, just stuff like that. And it
Yes,
freaks you out.
it
You know,
does.
you're driving to a familiar place like your child's
Right.
school, and you're thinking, did I miss the turn, or
Right.
is it coming
Right.
up or whatever? And I got to where I started having to use the GPS all the time,
Yeah.
because I literally would get lost going to familiar
Right.
places. I had to start avoiding driving and doing certain things
Mhm.
later in the day and shopping and all that, because
Yeah.
my brain just didn't work the same.
Yes.
And I
Now, have
got
you felt
slower at
that?
work as well. It just
Yes.
kept getting
Yes.
slower and slower and
So I was going
slower.
to say, so that had to be
Hmm.
harder for you, as
Oh
you
yeah.
related so much to your patients
Oh yeah.
having the cognitive issues. And then you're like,
Yes.
where's this going? What's happening? What's
Exactly.
happening to
They
me?
they were so kind. They were so gracious. They stayed with me till the end, till I was
Oh,
like,
I love
okay,
that.
I'm gonna quit now. They didn't care how long. My visits took a long time. I really was only seeing a few patients a day, but I just had a lot of support, and my job
Yeah.
was also very supportive.
Well, I think
I'm
that
really
speaks a lot of the
thankful.
doctor you were. I think that
Well,
you must have been a pretty good doctor.
I guess, well, they say I was, and my patients really loved me. So they really didn't care how little I was able to work. If I was
Right.
still going to give that level of customer service,
Right.
they wanted it. They
So
did.
what finally led to you deciding, or being forced to decide, that this is something I cannot do anymore?
I just felt like the working injured, like I'd been fighting it for 7 years, and I just felt like it was time.
Yeah.
Initially, I felt like I was realizing my purpose because I was using all the things I learned with my patients. I would see
Right.
people for whole visits and not prescribe any meds. I would just tell them, do this, do that, take the supplement. And they were also
Right.
happy. They'd go tell their friends, and their friends would come see me and all of that.
Right.
Exactly. So for a while, I did have fulfillment in that, but it
Uh,
got to a point where I felt like I was needed in the MS community because I had, especially physically, I'd made a lot of strides physically. I'd gotten out of the scooter, out of the
Right.
walker and all that. And I'd really, after the first 2 years where I was in PT almost continuously, I'd
Uh-huh.
come up with a home regimen that worked for me. And then over the pandemic, I started to doing the Zoom workout sessions that really, really helped. So I just felt like I had something to offer, stuff
Mhm.
that people out there were not talking about,
Yes, you
especially with
do.
PPMS. There,
Yes.
I just don't see anybody out there saying, okay, I have PPMS. This is how you can get, get better, or this is how
Not
you can
enough.
work
That's for
through it,
sure.
or whatever.
Yes.
And then another thing that happened was once I was able to stop working, I was then
Uh-huh.
able to really take care of myself and
Yes.
address things that
Yes.
I hadn't been able to get to, like my teeth, like,
Right.
the mercury level and just stuff like
Right.
that, that I
Which I
already
want to talk
knew,
about that. So talk to me about how that started. I know you blogged about it. So we'll
Mhm,
list that at the bottom of the show notes about
mhm,
where we can find you, your blogging, and we'll
and
get to
all
that.
that.
So talk to me about what it was like for you as you the beginning of dealing with the teeth issues that so many of us with multiple
Yes,
sclerosis don't know later on down the road that there
yes.
are going to be a lot of issues, whether it's and I get this word trigeminal,
Hmm.
right?
Yeah, trigeminal
Trigeminal
neuralgia,
neuralgia.
exactly.
Whether it's that, I haven't had so much with that, but I've had a lot of jaw teeth issues with all of the um, having all of the steroids, the IV steroids through the years. So yours is a little bit different, but one that I've heard of by several MS patients. So talk
Okay.
to us a little bit about what you went through in this.
Okay, so with the trigeminal neuralgia, that's something I've had for years, and it would be worse whenever I had a lot of inflammation. I was taking meds for it. I'm not taking any med for it right now, but and it was the whole left side of my face. It wasn't just one branch because there's 3 branches of the trigeminal
Right.
nerve. I used to get a lot of headaches, and it took a while for me to realize that when I got what seemed like a sinus headache or even a
Sure.
migraine, it was trigeminal neuralgia. Then other times it would be this part of it, and it would be the pain would be kind of here. And then the rest of the time, it would literally be in my jaw, and like half of your jaw would just hurt and tingle. And it was just really bad. Like when I got the
Yes.
type that felt like a headache, I'd literally have to, just go take something and sleep. So it
Right.
felt like a migraine pretty much.
Hmm.
So that was going on for years. But with the teeth, for years, I was in the at the dentist like every 3 months because I had gingivitis, and like you said,
Yeah.
it was just the health of my mouth just wasn't
Right.
getting to where
Something
it
is
needed
going
to be.
wrong.
Yeah, they would put all
I
these
feel I'm where
antibiotic
you were,
pellets.
but in
Yeah.
the beginning, I feel like I'm
Ah,
at the dentist all the time right now, trying to
yes.
figure out what is this? Where's your jaw?
What
Why are you biting on one side? Why are you at the
exactly?
beginning? It was why are you only biting on one tooth? I don't know. You tell me.
Maybe the other side is
So
hurting or something.
yeah,
You're like, I don't
exactly.
even know.
Right,
Because it's so many
exactly.
things going on. Sometimes it's hard to even pinpoint what is
Absolutely.
causing what. So I was at the
Yes.
dentist a lot, and over the years, I've been getting my mercury fillings, which I had from childhood. I've
Yes.
been getting those removed. Some of them, the tooth would crack anyway, and they would have to take it out. I had
Okay.
a root canal maybe 2006 or something like
Okay.
that. I had a root canal, and I come to find out that those can also be a source of chronic active inflammation in
Yeah.
those of us that have, autoimmune disorders and
Right.
stuff. So I already had one tooth that was missing, and I refused
Hmm.
to let them put the titanium in because I felt like the way that I am either sensitive or allergic
Hmm.
to so many things that
Right.
it wouldn't be biocompatible for me the way it is for other people. So
Right.
I refused to do that, and that dentist lied to me and said there was nobody doing anything else. There was a guy up the street. They just didn't
Really.
want. Yeah, there was a guy up the street. They said they didn't know
Well,
anyone.
newsflash, doctors sometimes lie.
Oh yeah, she lied. She lied and had me come
Yeah.
consult with her, her oral surgeon. And I was like,
Yeah.
no, I don't want the titanium and stuff.
Yeah.
So anyway, I finally found this guy up the street that was a biologic dental surgeon, and he said he
Okay.
could do the zirconium. So I was like, fine.
Which I want to put, because when I read that, I was like, a what? What?
Yeah,
So
yeah, a
explain what,
biologic
because I did
dentist.
not know. I had never heard that.
Yeah, they're
So,
biologic dentists and biologic oral surgeons, and they practice dentistry differently. They don't do metals, they don't do fluoride, they do a lot of natural things, like they use ozone, which ozone made me feel like heaven when he used that on me. Like my whole
right.
body felt like heaven because it powers up your, supercharges your mitochondria and all that.
Mhm.
I think in the UK or in some other countries, people actually use ozone treatment, but here you have
Yeah.
to pay an arm and a leg for it.
Right. Right.
Exactly, just like the hyperbaric
Right.
chamber that is not covered by insurance here. Anyway, I digress. So
No, but I get you.
yeah,
I understand. If we
yeah,
go that
they
route, we
use,
could go
I
there.
know, they use probiotic
Right.
chews and all kinds of all
Yes.
natural things, and they hardly do an antibiotic,
I love that. I'm looking forward
Exactly.
to that now that yes, looking
Yes.
forward to it.
I know you had asked about where can you find them. It's a
Yes.
website called
Mhm.
IAONT, I believe. Let me
And I
find
have written it down
written
too.
it down.
But
Okay.
yeah, so we'll put that at the
We'll
bottom
put
of the
that in
show
the
notes
show
as
notes.
well.
Okay.
So
Yes. So that people know where to
our,
find one
yes,
in
our
their
listeners that
area.
are having mouth issues, at
Mm-hmm.
least we know now. And I love this
Exactly.
because one of the things that I've said during COVID, which thought was such a blessing, is it has brought us all together.
It has.
And patients' voices saying, no, no more.
Mm-hmm.
We're ready
Mm-hmm.
we're moving forward, and we know how fast things can come together, and we need
Mm-hmm.
you to work with us. I know that was a conversation that I had with my neurologist when I came back to Michigan, saying, I don't want to drive all over. I don't want to fly places that I can't afford to get treated. I would like to go through this journey with you. Help me understand where
Mm-hmm.
you're at with this. And I think sometimes we can have those difficult conversations, and sometimes they work out well. Sometimes
Mm-hmm.
that's just that's what we need to know, that it's time to move on. For me,
Exactly.
it worked out well. And we realized that
Mm-hmm.
we definitely did want to continue our relationship as patient and doctor. And we figured out a way to do so. So what would you say to patients that are in a situation where they're not feeling heard, or even there's a team together for them?
I feel like get a second opinion, get a third opinion, whatever. You can see a neurologist that's in another city that will work with someone in your city,
Yes.
If you don't have a real MS center where you are, you
Right.
can, a lot of times they just need to see you in person for the first visit, and you
Yes.
can do everything else, via
Yes.
telemedicine. Because even before
Right.
the pandemic, my
Right.
MS clinic, they always did telehealth for
I
people
love
all
that.
over, all over the country.
And
So,
I
and
don't
they
see
would,
that going away.
no, it's not, because
Yeah.
now insurance, even because a lot of times then it was hard. They figured, I guess the visit part of it may not be
Mm.
covered. At least back then it wasn't. But they figured out how to work with someone where they are to get them the medication and whatever things they
Yes.
needed. But now that it's all mainstream and COVID
Yes.
has made it an option for us,
Right.
there's no excuse for anybody to say they don't have the right specialist around them, because
Yeah.
we can find one
Yes.
online, and you don't need to go see them all the time. If you can just go
Correct.
that first time and have someone in your city that would work with them, don't can just be a regular neurologist,
Right.
but as long as they're willing to work with that person who is an MS
Right.
specialist, then you should be fine. But you have to
Yes.
advocate for yourself, talk to other
Definitely.
MS warriors, get
Yes.
into support groups, make sure
Yeah.
you're active online with other people who are going through what you are going through, so that you can get
Amen.
answers. Answers come from
Yes,
everywhere. They come from
absolutely. And
everywhere.
and I would say with that, there's always a negative side of social media, and there's a positive
Mhm.
side. And it's up to you, just like it's up to us to advocate. It's up to us where we're going in social media, where we want to
Mhm.
be connected to, who we want to be connected to.
Amen to that.
Are they
Especially on
moving us?
IG.
Yes.
IG is
Yes.
easy to curate your feed. I
Yes.
am so focused on IG. I hardly go to Facebook anymore, because Facebook
Yes.
is so busy and
Oh,
so
yes.
full of fluff. And then you got the
Mhm.
politics, you got the religion, and then you got all these
Yes.
people you knew from childhood that you don't
Yes.
have anything in common with. And I am so over it, you know?
I'll get a message. I haven't heard from this person in 20 years, and they'll say, "You have MS. I have a friend of a friend that has MS. Can you give her a call?" Sure. In the 5 minutes I have in the day,
I
I'll call
know.
this person
Or
that
can,
I
can I
don't
give
even
them your
know. Yeah.
number, you know?
Right.
And I'm like,
Yeah.
have them,
It gets
I'm
to
like, have
be
them follow me.
right.
Oh, they're not on social media. Well, if they're
Right.
looking for answers, they're gonna have to show up.
Exactly.
They're gonna have
And
to
like
show
you
up
can find me on
somewhere.
Zoom, you can find me on podcasts,
Yeah.
you can find me. So there'll be answers, they can find me.
Yeah,
So
there are a lot of people who are
it's
not otherwise active on social media. They don't post, they don't do anything, but they
right.
come on there and hook themselves up to people they
Yes.
want to hear from, and that's all they do.
Yes.
So it
Exactly.
is doable. You don't have to be an active social media person.
Right. And I think that's
Yeah.
important that you said that, because I do believe that it can sound scary. And especially now, when sometimes I feel like Instagram and stuff can feel like, there's so many scary subjects that come up.
Yeah,
And
it can be
sometimes
heavy too.
I just need a
Hmm.
break. I
Hmm.
remember going for a small walk with my puppy, the puppy cage of my therapy
Oh.
puppy. Um,
Hmm.
and I remember just seeing, and it was, not dark enough where everybody was shutting their windows or their blinds yet. And you could see, and I thought, wow, everybody's got CNN on, Fox News. And I thought, is this
So
what people do
unhealthy.
every day,
So
to get themselves,
unhealthy.
their anxiety all up? And so I would say to that, and
Mm.
I'm sure you agree, be careful
Oh
what you
yeah.
see, be careful what you put in, let in.
What you
That,
listen to. I don't do the news. If it's
no,
important enough, I do see it on social media, or I get the
yes,
alerts. I do get the
yes,
alerts, and I can
yes,
click on it if I want to read it and
yes,
go to that media page or whatever. But if I walk in the room and my husband is watching the news, he'll change the channel because he knows I don't want to see it. I don't
right,
want to know.
right,
If it's important enough, someone will
yes,
tell me, or I have other ways of knowing, but I
absolutely.
cannot feed my mind with all this negativity because it
No.
doesn't help me conquer MS.
And I love what you now talk. No, it doesn't help you conquer MS. Talk to me about the clutter, because I love the way that you said that. And talk to me about
Yes.
the clutter, because I see it in so many ways. The clutter of our minds,
Mm-hmm.
the clutter of, for me, that's always, I find it always a battle when our MSers are honest about trying so many things, gadgets,
Mm-hmm.
everything to stay organized and
Mm-hmm.
decluttered. And I end up
Mm-hmm.
having more clutter than ever with my
Yep.
decluttering projects.
Yep.
So
I have a video series that I actually did on this. I talked about people clutter, having people in your life that don't need to be there anymore, that, some people are in your life
yes,
for a reason, some for a season, some for a lifetime.
yeah,
Then there is the clutter that is stuff, physical stuff, which is what, I talked about. That's what I'm going through now, is
mhm,
finally I'm getting to the place where, because if your brain isn't working right, everything else is going to be a clutter, and it
that's
starts with the
right,
clutter in the brain. So the third part
right,
of it, of course, is the clutter in the brain. And
right,
if when that starts to clear,
mhm,
then you can start to sort through the other things. So I'm at that point where I'm actually starting to just go through my house slowly and get rid of stuff and
yes,
rearrange stuff and,
yes,
organize and, just one room after the other,
yeah,
and just slowly going through it with whatever reserves I have,
yeah,
But people don't really talk about this stuff in
no,
MS. And that's why I'm glad that we have that talk coming up,
yeah,
because
oh yes, for
I'm definitely
sure.
going to ask about
Yes,
that, because I have a diagnosis of cognitive decline. I
uh-huh.
actually saw a neuro psychologist, and
Okay, you
the initial
did,
one I saw said I had slow processing speed, but that
okay,
was a neurodevelopmental one because I was trying to get screened for autism when my daughter got
okay,
diagnosed. So then I saw one that actually sees MS patients and adults and everything, and then she did confirm that, yes, I do have cognitive
interesting,
decline.
yeah.
Yeah, so
Yeah,
it's on
that's what I
paper.
want to look at right now. I know it's I have really struggled with, and so I think it's so important to talk about, because I'm
Mhm,
missing appointments, getting the
mhm,
appointments wrong.
mhm.
Um
Even though it's in
having
your calendar,
oh
things are in my
yeah,
calendar, and I'm
dinging
still
is
not
all the
able.
time.
Yeah,
Yes.
not able to stay on top of it.
Right. And I think that that's a shame that we feel We feel ashamed, like, oh my gosh, and terrified a little bit. Like, what's the next step? Is the next step like dementia? And then I put me in memory care. What happens now? So I think there's a real concern and fear and some hiding that we do so that people don't know we're quite as cognitively
impaired,
losing as much exactly as we have.
It's an
And so
impairment.
yes. And so I think being more honest and open about this is because I remember this is about you, so I don't want to go too much about but I think you can relate to this. Ed Will, as a business owner, telling some of my staff that I was having cognitive issues. It became this thing where, well, remember, she's probably going to forget. And I was like, no. This isn't, I'm still your boss. I'm not like mentally ill. I just need you to understand if I don't get back to this, these are things I'm working on right now.
I need a gentle reminder or something,
So it is difficult when people don't understand that. They begin to treat you as if, she doesn't remember. She may need to go into, a special place soon. It's like, no,
it's not that kind.
Right. So it is difficult. And I think definitely looking forward to our Wednesday night, our Wind Down Wednesday. We'll have our neuropsychologist, Dr. Megan Byer, and she will be asking her some really important questions.
So excited for that.
Yes, me too. So now tell me about where you are now, what you're doing, what I can look forward to, because I think there's one thing you said about medicine that I loved, highlighted it. Medicine, unfortunately, is more sick care than healthcare.
Yes.
Tell me that before we go on.
What it is conventional medicine, Western medicine, great for acute care, hospital, and all of that stuff. Thank God, it exists and all that. But when it comes to managing chronic illness and preventative care, we are just not doing enough. The annual physical and the PAPs and the colonoscopies and mammograms, they're not enough.
Right.
We need to really, really get to what is the root cause of illness. Most of it has to do with some form of chronic inflammation or the other.
Sure.
And we're still not connecting the dots in Western medicine of going back to look for viral infections, fungal infections, bacterial infections, things that are just smoldering. And that's why they think stuff like the root canal is not causing any problems, where I understand that every single root canal that was taken out and sent for testing always is full of microbes and stuff that are not supposed to be in your mouth and that are causing inflation. So
and things we don't
haven't
know.
connected the dots enough.
Exactly.
Yeah, I know we talk about diet and everything, and that's another thing. We don't really get trained on nutrition, so it really depends on what you take on by yourself. If you're going to be a primary care doctor and you'll be telling people do this, do that, we just don't get enough training on nutrition and stuff. And even the nutritionists that are not holistic nutritionists, the things they're telling you are just not enough. Some of them are frankly not even how it is.
So many times. I think the older we get, the more should I say assertive we become. And you hear things and you're like,
they're like,
what?
Nah.
You're number one, you're the age of my child. Number two, I don't think you've studied this quite enough to understand what you're saying. So I know
I'm leaving it,
And it gets to be difficult when you hear them talk and you're like, oh boy. So So now how did that progress? So now you're moving forward, and tell us about the program, but also your nutrition, your antioxidant, the things that they can find on your website, but also you're moving into this. You've done this for a long time. You've changed your eating habits. You're following things pretty strict for your body that works for you.
Exactly.
And now you want to give back what? What are you going to be doing?
Okay, so with the nutrition part, I do the Walls protocol, the level 3, which is the Walls Paleo Plus, with the intermittent fasting and an element of keto. But I know people go crazy when they hear the word keto. It is nothing like what you think. It is all whole foods and good fats. And the intermittent fasting part of it, it's kind of like the same way that it's a therapy for for seizures and stuff.
Mhm.
The same way it works for primary progressive multiple sclerosis, where it literally is like a therapeutic diet for
Interesting.
PPMS, exactly. And then you are able to activate what we call autophagy and all that,
Mhm.
where your cells get the time in between feeding to clear of debris and
Mhm.
stuff. You're not
Right.
constantly, having your body doing stuff. So
Yes.
that's
I
what I
love the
do.
way you're explaining that, because
Exactly,
so often
exactly.
I'll find clients that are going to do it, but they have no
Mhm.
idea why. They don't
Why?
know what it is
Exactly.
how it's going to help them, the
Yes,
benefits, getting rid of some of the stuff that in between time, they don't
exactly.
quite understand that. They're just
Stand,
doing it
but
because it's
someone's told them to do it
right.
and they're like, yes. And
It's a
it's
new
good to
fad.
understand why, so that when you
Yes.
want to cheat, you also know why you don't want to cheat,
Right.
and stuff like
Exactly. To
that. And
me,
if
it
you
goes
feel
back
bad, what did
to
you do,
right.
to make you feel bad?
I think it
Yes.
goes, and I know your faith has gotten you through several
Oh,
things.
yes.
We've been able to talk about that, and I
About
love
that,
sharing that with you.
yes.
Um,
Me too.
I would say that for me, it goes back to if I'm going to go on a fast, if I
Mhm.
don't write down the amount of days I'm going to be doing that fast and what it's for, I
Mhm.
can darn well talk myself into why I need to eat day
Mhm.
3 and why
I
I need
know.
to, because if you
You,
don't
you
have that written
a
down, you forget.
purpose and a why. You have to be
Yes,
so connected to your why to be
yes,
successful at all these things, because it's
absolutely.
it's they're not easy to do.
No,
They're not easy
no.
to do at all. So,
So
and
as we
then
change our diet, that's the
mhm,
same thing. If you don't know the
mhm,
why, if you don't
exactly,
know, then you're probably not going to stick with it.
exactly. That is so true. So what I'm doing right now is I am getting into the holistic wellness space as the MS educator. And
Yes.
basically, I help women with MS live a holistic, thriving life so that they can have
Yes.
less symptoms, less flares. They can have an improvement in their functional status. If they're disabled, less disability. Just move people closer to wellness with whatever little steps we can take.
Right.
Recovery doesn't look the same in everybody, but
Right.
usually there's always something we can do rather than not doing anything. And
Yes.
these are things you can do in addition to medicine. Some
Hmm.
people do it without medication. Everybody's different. You just have to do what your own body seems to be responding to or seems to be
Correct.
needing. And there's no cookie cutter. Even all these nutrition plans for MS out there, you have to make little tweaks based on what's going on in your body, what
Right.
testing shows, and all of that. And
$100%.
if you need help figuring it out, work with someone that's doing it.
Right.
For me, I am creating an online course that will
Okay.
communicate all these things I've learned over the past decade so
I
that
love
people
that.
know what to
Yes.
do. And believe at some point, either right from the beginning or later on, probably will be a membership as well. But I'm still
Yeah.
trying to, figure out all of
Oh
that.
yeah.
First time business owner,
I
so it's a
understand.
learning
I got
curve.
you, girl. I got you.
Learning business, learning IG for business, and just
Yes.
getting putting myself out there in the MS space and meeting wonderful people like you. And
Well, ditto. Back to, I was so excited to have you on and that you came on, and that we're going to do
yes,
some other collaborating together, which I'm very much
yes,
looking forward to. And I'm
yeah.
just so excited for this for you. I'm excited that you're branching out, that you're doing this, because I think it so much says who you are. When you were in internal medicine, when you were a primary care physician, your
Mhm.
favorite part was the people, were your
It was.
patients, was connecting.
Yes.
And yet don't you see God leads you right back to his purpose. And you're going to be helping women with MS, learning about themselves, about how they can holistically do things,
Yes.
how you can encourage them. And we need that. There's so often, as you know, this isolation feeling that we often feel. And I
Yes.
love that you're doing it. And it brings me to that point of, don't be afraid to go to another support group. It is scary.
Yes.
I've been to support groups. My first one was in a scooter shop, and that was highly depressing.
Yes.
So, you're in your 20s and you go to a scooter shop that's supposed to be inspirational. And I was like, this is horrible.
I
So do your
know.
homework and find someone like you, who's going to be inspirational and give you things that are positive. And I think that that's so the beauty of us working together and learning more about, like, so I can then refer someone to you, and then you know what I do
I can
in the
refer
MS
someone to
world.
you. I love
Exactly.
what you do, and I
Thank
appreciate
you.
you.
Thank
You are
you.
super awesome.
Thank you. Well, I feel the same way about you. And I'm so grateful that I had an opportunity to have you on. All of this stuff, give me one quick way. How do you want people to get a hold of you? So
My website is folaketaylormd.com.
I love it. Just rolls off your tongue. I keep trying to block it. It
still
just
trying to do
rolls
it.
so beautiful off your tongue.
And then I'm on IG a lot. So on both IG and Clubhouse, I am at Folake Taylor.
You're getting to be
MD.
quite, I interrupted you. Go ahead, say it again.
At Folake Taylor MD on both IG and Clubhouse. What were you going to say?
That I'm noticing you are a really good dancer. You really got some moves, girl.
I think I'm getting better at that. And the other thing I forgot to mention is you had talked about the antioxidant document. Yes, either in my link in bio on my socials or on my website, you can find that resource about that's like a cheat sheet on antioxidants, and it
really good.
I
went through
a lot of stuff.
So Debbie, if you haven't gone there, go there, because you've done the work. And so it's worthy of being looked at and being admired, because you've done a lot of work too. I'm looking forward to this program that you're putting together. I know it's going to be great. I can't wait to see it.
Much.
And I can't wait to work with you in just a couple of weeks again.
I know. I can't wait. I'm looking forward to it, Kathy.
Me too.
Thank you so much.
Well, I enjoyed. Thank you so much for being here. I love chatting with you, and I'll say goodbye to our listeners. Have a great day. We will talk to you next week. And like we say, if you don't move it, you will lose it. So let's go.
Yes.
Well, thank you so much for joining us today on Move It or Lose It podcast, where you can again find us every Tuesday, and also wherever you like your podcast, whether it's Apple, Spotify, Stitcher. Join us on that, and we can't wait to see you again. We're going to have a lot of exciting guests and working together. And as always, you'll hear us say at the end of every podcast, we are stronger together. So let's do it. Let's become stronger together.